So the good news about prolapse is that it is not the end of the world if you have a prolapse. It's not something you have to learn to live with. There are things that can be done to help rectify the situation. So there are three main courses of treatment for prolapse, which I will speak a little bit more in detail. But first is strengthening the pelvic floor muscles as well as your core and your breathing. And then the second mode of course of treatment is pessaries. And then third is surgery. So with pelvic floor strengthening, it's a lot more than just doing Kegels because it's not just the pelvic floor that we want to address. The pelvic floor works in conjunction with your core and as well as in conjunction with your diaphragm. It kind of like forms a tube. Pelvic floor is on the bottom, your core musculature as well as your multifidi, which is in your back, they make up like the sides of the tube, and then the diaphragm sits at the top. And so those four components need to be working together well in order for the pelvic floor to also be working well. So that's why we have pelvic floor therapists, because they address that whole system together and they can help you to get it all working together better. So then next, if pelvic floor strengthening doesn't work for you and you still have prolapse symptoms, the next course of action would be to use a pessary. And so a pessary, these are our pessaries here. It is something that you would insert into the vagina to help support the organs that have prolapsed into the vagina. So like with the previous shot of all the organs that can come in. So there's different types of pessaries that you can use. And so a pelvic floor physiotherapist can help you to, or not all pelvic floor physiotherapists, but some, and some of them work at our clinic, they can help you to choose the right pessary for you, get you fitted for it, and it goes in like that. And Tori even has a video talking about pessary insertion. So then, of course, the third course of action is surgery. And so if steps 1 and 2 didn't work for you, then that's when you'd want to get referred for a surgery. But the good news is that if you've gone through steps 1 and 2, then the surgery is usually a lot more successful than if you hadn't done your strengthening first and you hadn't tried the pessary first, because it helps to address some of the underlying causes for the prolapse. And so now a surgery is going to be a lot more successful.